name is Koenraad Dierick, and since 4 years I'm leading the Health Economics and Market Access team at Terumo Blood and Cell Technologies. Our objective is to make sure that as many patients as possible have access to life-saving medical interventions based on blood and its components. We do this by making sure that the value of blood and its components are well understood by payers, authorities, patient associations, physicians. That is what we are living for day to day. Now, what is health economics exactly? I'd like to think about health economics as a race. Multiple participants in this race all have the same objective. They all want to serve an unmet medical need of a patient. It is a very competitive environment in which two parameters will define whether you win or whether you lose the race. The first parameter is, can you provide a clinical benefit to patients? The second parameter is, at what cost are you able to provide that clinical benefit? If you can provide a substantial clinical benefit at an acceptable cost, or even better, at no additional costs versus what is available today, then you have a good chance of winning the race. That is what health economics is all about. Now, what are we then doing in terms of health economics related to the Terumo Blood and Cell Technologies? Well, one may think that blood as a product and its components are available to all across the world. The reality is that this is not correct. In many countries in the world, blood is a scarce product on the one hand, and on the other hand, it is also true that patients often have to pay out of pocket to get access to blood and cell therapies. Our teams, our health economics team, daily job is to make sure that as many as possible patients have access to these blood and cell therapy based medical interventions. So what does it then mean specifically for our customers active in the cell therapy space? Well, Terumo desires to make products that allow our customers to enter the race, the health economics race, at the lowest cost possible, so that ultimately they can access as many patient lives as possible. You have to imagine that payers' pockets are not infinite. They have to choose which medical interventions to pay for and which not to pay for, or partially pay for. Cell therapies tend to be expensive versus the current best practice. So payers will review them with substantial scrutiny. Our health economics team is dedicated to making sure that we are able to demonstrate the health economic benefit that we bring to our customers with the Terumo Cell Technologies.
Thank you, Koenraad. FINIA is a functionally closed system that automates mixing, cooling, air removal, aliquoting, and sealing. This includes cell suspension to prepare for cryopreservation. FINIA automatically completes the steps of the fill and finish process through guided user interface, managing variability and risk while reducing operator hands-on time by 36%. FINIA requires 12 minutes of hands-on time with one person. The manual process requires 35 minutes of hands-on time by 2 people. Over the course of an hour, FINIA lets you do 3 times as many runs versus a manual process, leading to a 50% labor cost savings over the course of a year. Manual formulation, fill and finish lack process controls, which can impact cell viability. FINIA automates process controls for temperature and the rate of cryo addition. Post-thaw cell viability is maintained at greater than 90% and uniform concentration at 5%. FINIA helps to reduce risk in the final stages of your process. That not only means the loss of the product, but also the time and money invested to this point. But more importantly, FINIA can aid in getting your products to the patients that need them quicker than a manual method. Contact a representative to see how Terumo can put health economics into practice for your business.